Okay, Mr. Chair, we are live and I will read the remote meeting script. Good evening. My name is Kristen Black. I'm the health agent for the town of Northborough. This is an open meeting of the Board of Health and it's being conducted remotely consistent with Governor Baker's executive order of March 12, 2020 due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the risk of transmission of COVID-19 virus, the town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor order suspends the requirements of the open meeting law. The requirements of open law to have all public meetings in a publicly accessible physical location. All members of the Board of Health are allowed and encouraged to participate remotely. The order allows the boards to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation. Unless participation is required by law, this meeting will not feature public comment. Each vote taken by the board will be conducted by roll call vote. So I'll hand it over to you, Mr. Chair, if you'd like to begin with a roll call attendance.
Yes, we'll take attendance. Today is January 12th, 2021, 6 o'clock. And just say present when I call your name. Dilip Jain.
Present.
Swati Sane.
Present.
Teresa Capabianco.
Present.
Kristen Black.
Present.
And we have Diane Laguerre.
Present.
Good. All present and accounted for. We'll begin the meeting. Turn it back over to Kristen Black, please.
Okay, I'm just going to, bear with me a minute. I will pull up my PowerPoint presentation when I can find it on my share screen here. This tool, I'm not sure. Sorry, just.
Well, while you're doing that, we could go over the minutes from the last meeting, December 8th, 2020. Does anyone have any objections to the minutes as recorded from December 8th, 2020?
No.
Teresa, no. Dilip?
No.
Swati? Swati? Perhaps she's reading. Dr. Sane? I feel like I'm on Mars. Dr. Sane?
Let's see. She may have, or her feed may have frozen.
Maybe.
You can see her moving. Swati, can you hear us? Swati, can you hear us?
Okay. Okay.
Well, we'll move on. Are you ready?
Yep. So do we want to do a roll call vote on approval of the minutes? Was there a motion made on the approval of the minutes?
There was no motion because Dr. Sane can't hear us, or we can't hear her.
Now I can hear you.
Oh, okay,
Okay.
great.
Okay, so she's the last one. Dr. Sane, have any objections to the minutes from December 8th?
No. No, I'm fine.
Okay.
Thank you.
All right. Dr. Jane, you want to make a motion, please, for the approval of the minutes from December 8th?
I make a motion to approve the minutes for the December 8th, 2020 meeting of the Board of Health as recorded.
I second that. All those in favor?
Aye.
Dr. Jane,
Aye.
Dr. Sane,
Aye.
Attorney Capabianco,
Aye.
and Attorney French. Aye. Unanimous.
Great. Thank you, Mr. Chair. Can you all see my screen at this all right now? Well,
Yes.
pull up the
Yes.
presentation. Okay, so there's your agenda, Mr. Chair.
Okay, here's the agenda. Number 2, appointment of the new temporary food inspector, Diane Legary.
And so,
Yes.
Mr. Chair, if you're comfortable, I'd love to give a quick introduction for Diane. And so Diane was recently appointed just last week, and it's, Diane, you pronounce it Legere or
Yeah.
Legary? Okay, so Legere, okay.
Of course.
It's
All
fine.
right. So Diane comes to the town of Northborough with experience serving as a food inspector for several years in both Webster, Uxbridge, and she's also done some private food consulting and has a background in in contracting work and project management. So I previously have worked with Diane in the town of Uxbridge in her part-time role as a food inspector, and was always really impressed by her work. And I did try to encourage her to apply to her open position. So just for all the board members, just to remind you that we've always sort of had a part-time or approximately 8 hours a week food inspector position. It was long held by Bill Fisher. But just given the demands of COVID, he was pulled in a few other directions and really couldn't give us that full 8 hours a week that we need to keep up on our inspections. He did resign from that position. So Diane's filling that long held position in the temporary role. There are some discussions with the town manager of trying to make it a permanent position, but just for the sake of refilling it, it was a temporary assignment. But Diane, we're really excited to welcome her to the town of Northborough, and want to take this opportunity for all of you to meet Diane. You were given copies of her resume and cover letter so you can see her background. But Diane, can you just say hi to the board, give us a brief introduction? That'd be great.
And there, it's great to meet all of you. I'm really looking forward to coming to Northborough. I know the area quite well. I currently am working as a health agent for the town of Uxbridge. I handle all the food and compliance issues there. So I have a strong background with food inspections. I'm also current with the Food Co Pro software, which I understand you are looking to bring into town. So I'm well versed in that as well. I also handle high risk food populations. So that would be your schools, your sushi, your any nursing homes.
Great.
Great.
So, and I
Welcome.
think
Welcome.
Thank you. Thank
Yes,
you.
welcome aboard.
Thank you.
The only real, the giants are like the Wegmans, and that whole loop, really. That's the time consumer.
Yeah, I was thinking Wegmans must be an all-day affair.
That's been the complaint.
Yeah.
But they're clean.
Yeah.
They do well.
That's awesome because I shop
You know?
there.
Yeah. No, they do well.
That's wonderful.
they're a very cooperative corporation.
Excellent.
Okay, should we move on? Well, welcome aboard. And we look forward to reading your reports.
Thank you.
And so Diane should officially have an email, hopefully tomorrow. So we'll share that with all of you. And Diane will be helping with our COVID complaints related to food establishments. Will be a huge help with the office right now. So really excited to welcome her, and we'll make sure to share her contact information with you moving forward.
Great. All right. Kristen, you want to move on to the next COVID-19
Sure.
update?
All right. What else could we possibly talk about?
This is
So
it.
I think this is
the
my
big-
Yeah, so this is my, and Diane, you're welcome to stay if you'd like to hear, but don't feel that you have to stay on. So I'm excited today to just give the board a brief update on COVID-19. I provided a similar presentation last night to the Board of Selectmen, and also was able to attend I'm always on a Frank and Mary show with the Senior Center today, talking a lot about the vaccine. And so I just want to provide this brief update to the board, just sort of on where we stand with numbers since we last met. So our community risk level, so this is, the state categorizes us based off of two metrics, really the total count over a 2-week window, and then our the percent positivity rate of the PCR tests that are coming in. So our PCR number of the test results is just below 5%. So the last 2 weeks we've been moderate or yellow, but overall our case counts are very high. Over the last 2-week window, you can see ending on January 2nd, the state of Massachusetts Department of Public Health weekly public health report showed we had 107 new cases in that 2-week window. So, I mean, you guys can think back to the summer when we had 1 or 2 cases a week, so we're still on that surge that we expected after the holidays. So the total case count, is 830 as of actually yesterday, I should say. That wasn't tonight, that was yesterday. So total cases in town. So, this is the graphic we put out every week just to show all the numbers really just on one shot here. So again, we're at that moderate total case count since the start of the pandemic when this was posted on January 7th. And this is on the town's COVID homepage. 801 cases, the approximate number of active cases, which is how many people in our community diagnosed, positive with a PCR test only, and that are still in that isolation window, that 10-day isolation window. And again, the percent positivity. So the relative change in case count number was actually slightly lower this week than the prior week. So you can really look at that's over the 2-week period. It was relatively lower, but if you look at this graph here, this is showing the total cases by week ending on the Sunday. So ending on January 2nd, we had a total of 66 cases in the week. So we definitely bumped up from the holiday window, but we didn't see that spike that we saw the week after Thanksgiving, where jumping to 93 was pretty exceptional. So case counts are still very high. And again, public needs to be very vigilant. And for the reasons of statewide high numbers, you can see that we are still in that restricted window after the holidays with some of the reduced occupancy. So this is the age cohort graph that's also on the homepage. Some people are interested in saying, hey, is it everybody at our assisted living? It's just people over 70. And we are seeing more younger individuals showing up in this age cohort graph, but this fluctuates weeks to weeks. No large clusters were identified in town, so it's really just a lot of individual cases or a few in a household throughout the community. So again, because of these high counts we're seeing across the state, the statewide rollback that the governor announced in the press conference on January 7th was extended through January 24th. And so what we see is that we have these reduced capacity restrictions of around 25% in most industries in Massachusetts. And again, the gathering limits for indoor gatherings at 10, outdoor at 5 people, those have been continued again through January 24th, and maybe extended further depending on where the numbers are for the state. But I think really what everybody wants to talk about now, and really we're shifting our energy in the health department, it's all about the COVID-19 vaccine. And so as you can see here, you know, we have, there's really 3 phases. This is the Massachusetts plan. This graphic was even updated since I think the last time I showed you last month. One noteworthy change is in phase 2. The first bullet has always read individuals with 2 or more comorbidities. It was recently revised to say, and also anybody, you know, 75 years of age and older are going to be at the beginning of phase 2. So I have some more slides on the vaccine. This is just a nice overview of these phases on this graphic here. And also the rough timeline is at the bottom of this graphic. You can see we're in phase 1. And I'll get into some more details. That window's December through February. We're hoping to move into phase 2, February through April, and then April onwards would be our phase 3. I've had some questions about the availability of the vaccine in Massachusetts. And so I have the link here. The state, just like they put out the weekly public health report, they're also producing a, you know, weekly COVID-19 vaccine report. And so, you know, the question is how many vaccines are in Massachusetts? So these are, you know, the total number, and this was as of the report on the dashboard dated January 7th. There are a total of 328,000 cumulative doses. So both the Pfizer and the Moderna that have been shipped to Massachusetts. So I'm thinking that number is really going to jump with this next week, because obviously this rollout is quickly proceeding. And this next slide here really just shows you the vaccine shipment by county. So in Worcester County, for example, with that week period, the January 7th report, we had only received 33,000 doses of the vaccine that were actually distributed to our county. So we're still fairly early on with this report. So I think this report or dashboard dated January 7th is the first of these weekly vaccine reports. People can refer to with the previous link. And so I have a nice picture here. You may recognize this individual. This is Mary Ellen Duggan, who is our school wellness coordinator and RN. She's like our lead nurse for the schools. She was nice enough to share this photo so I could put it on the slide. So it's really exciting to see our staff are receiving the vaccine. So again, we're currently in phase 1. First responders in town were just vaccinated yesterday and today at a regional first responder clinic run by the town of Westboro, their health and fire department. So a big thanks to them for running this regional clinic. As well, Marlborough Hospital has just opened this week, a first responder clinic that's open statewide. So if you go on the state of Massachusetts' website, you can actually search under first responder clinics. There are at least 85 stood up across the state, many of them regional, and Marlborough, which is local, is serving as a first responder site as well. First responder clinics were stood up, but they didn't stand up, you know, school nurse clinics. So I had to find another place to send our school nurses. They are at the priority of the phase 1. Because they were doing weekly testing of our students, which is amazing. We have a very active nursing group, thanks to Mary Ellen, the work of the medical advisory team. So we were able to secure the school nurses vaccines through Harrington Hospital, and they were vaccinated at their Southbridge Armory satellite site. So a big thank you to Harrington Hospital for finding the vaccine and taking care of our school nurses. The long-term care facilities in town, so the Coleman House, Beaumont, Whitney Place, they are all contracted through federal contracts directly with CVS, and their clinics are being held this week as well. And so they are well onto the way midweek of them all receiving their first vaccine dose. And so with the school nurses, I believe most of them, they've received the Moderna, the same as the first responders. The long-term care facilities, that CVS contract, they're receiving the Pfizer vaccine. And plans are being developed as we speak to stand up a local clinic or a regional clinic in our area through phase 3. So I'll talk about that a little more. So this graphic was just shared today on the state on our statewide DPH call with local boards of health. I thought this was a great slide. So this is all specific to phase 1. So in order of priority, we have these rows here. So the first to be vaccinated were our COVID-facing healthcare workers on the top row. All the yellow arrows on the left, it means we're actively in those phases. At the top, you can say, here we are in the second week of January. So those, the vaccination, again, healthcare workers started first in December. long-term care start at the end of the summer, and that's where, and now they're being vaccinated. First responders again officially started this week, although some were vaccinated a little earlier. And then next is really moving on to congregate care settings is the next on the list. For us in town, that may mean some of our group's homes would qualify under that. And then sort of the remaining for phase one would be home-based healthcare workers and these non-COVID facing healthcare workers. So there's a much more detailed description on the state's website for those categories. So one thing we're doing as the local health department is we're fielding a lot of questions from these healthcare workers, congregate care settings, home-based healthcare workers. Where do I get the vaccine? And so again, our first responder clinic with Westboro was only 400 doses, and that was specific to first responders. So what we know now is that large statewide vaccine sites will be opening in the coming weeks. You probably heard, I think the first to open is going to be Gillette. I've heard of Fenway. I've heard of the Topsfield Fairgrounds, the Big E. I also heard there's some discussion about, I believe it's the Macy's location that at the Natick Mall. So we're gonna see more. I don't think that Natick location's official. The other ones are coming, and we'll be waiting for announcements from the state as to when they open, who's allowed to go, and what's that registration process. Also, again, like the local hospitals are beginning to expand their vaccination program to other healthcare workers, not just their staff. Harrington Hospital down in Southbridge is really leading the charge on this. They're sort of well ahead and have been working their way through phase one. I'm excited that Marlborough Hospital's on board, and I just sent another email to their director of nursing, John Kelly, as to, please let us know when you expand, because what we can offer as a local health department is helping to be in the know and connecting these individuals who fall in phase one to get the vaccine. We also can anticipate that medical providers are going to begin applying directly to the state for the vaccine. So we're going to hear more of doctors' offices, that are willing to vaccinate other healthcare workers, et cetera. But whoever receives the vaccine has to be approved by the state, fill out a form, and they have to all adhere to this phase plan. There really shouldn't be any jumping ahead. And then next we're on to phase two. So that's what we're planning for locally. And so phase two, and this is anticipated to begin February through March, is listed in order of priority. So we're going to again start off with these individuals with 2 or more comorbid conditions, or individuals ages 75 and over. So we are starting to field questions from the public. What is a comorbidity, and how do I know, and will I need to document it? The state hasn't released all too much information on that. Obviously, those conditions are clearly listed on the CDC webpage, and I have a link for that later. And whether or not an attestation form or an individual would need to sign for that is still to be determined. But I think individuals will just have to self-attest, and we're going to take people for their word as they approach these comorbid conditions and documentation in this phase. And then we're going to move on to these other workers, which will be early education, our K through 12 teachers, grocery, utility, food, agriculture. I mean, the list just keeps going. I don't need to read it all for you. Our DPW workers come in, convenience store workers, wastewater, utility staff, court system workers, adults, I missed a bullet there, adults 65 and older, and then individuals with one comorbid condition. And so, I've heard hearing from people, phase two may be bigger than phase three, right? So, there's a lot of people that are going to fall into these categories. And again, remember when we open to the general public with phase three, that's individuals 16 and older. So, people ask a lot, where do kids fit in this? Well, it's not yet approved. So more to come on that. So I just want to provide an update. One thing, again, we're trying to do locally is just being able to connect individuals looking for the vaccine with these available vaccine sites. And so here's a link that I created today, the tinyurl.com/Northborough vaccine. We have, it's a Google form I use. So we are collecting people's name and their email address, and then they will actually go through that list. Please select yes or no if you have 2 or more comorbidities. So we'll be able to sort that list and then email people when these vaccines become available, and so it's not going to be one location. right? Like CVS and Walgreens may be opening, local doctors. So the whole idea is that we'll help to try to keep those local lists and try to connect people who are looking for the vaccine. So at this time, we're encouraging residents to complete this form, or even employees for the town of Northborough. So if you work in Northborough, we're really trying, what's going to be difficult to, according to the state, our next phase is these home-based healthcare workers. So I really want to encourage people, if you know of anybody providing care to someone in their home, you know, a personal care attendant, sometimes that's official and they work for a big company. Sometimes it's, I pay a friend to help my mother and she helps her with some, cleaning or care in the home, and they qualify as well. So a lot of these rules and categories aren't, black and white or show up with your ID card or get turned away. It's a little gray. But the whole idea is, we want people to know when they're allowed to get the vaccine. We want to help connect them to these resources. So more to come on this. And, I think I can stop that screen share. And so it's really talking to the board and why we did want to hold this meeting this week. I don't have too many updates on reflexology. We'll get to that next. But there's really two options for us moving forward if we want to try to stand up our own standalone clinic, working with the fire department and our staff and our contracted SAM and VNA nurses, or if we'd be looking to regionalize those local clinics up through phase 3. So the Department of Public Health is open and encouraging local boards of health to run COVID-19 vaccine clinics, but they really want us to be able to have the capacity to stand them up all the way through phase 3. The first responder week that we're in right now took a lot of effort to set up 85 individual clinics that are running for 2 days, shutting down and then running for another 2 days for that second dose. And the state's looking that if local boards of health want to run the clinic, they really want you to have the capacity to stand it up for that full duration. So those are some of the things we're looking at. I'm interested in thoughts from the board. There is a whole approval process and forms and prep mod, and do you bill, do you not bill? So I'm working through all of those requirements. It's not easy. Vaccine storage isn't easy, but I think one thing I'm passionate about is, I want to make sure our residents get that first access, right? We want to make sure they're first in line and get the best public health, and care we can provide to them.
So if we stand up a vaccine program, does that ensure that we get more doses and better access to doses? And what does the fire department have to say about the whole thing?
Well, we have a really good chief. Our Chief Parenti is on board. And so I think we sort of realize that, so whoever orders the vaccine, right, there's always some left and you got to put it in somebody's arm. They're not looking to waste. So when it's in-house and it's in your community, you just work through it faster, right? If you're in 100 dose increments and those sort of things, that availability, it's easier to slide somebody in when they met versus dealing with supply and demand, right? If we can take better care of our residents, if we can guarantee the supply. So the fire chief is on board. We were talking through storage options. The obstacles aren't insurmountable, but it's really something that we want the whole community behind, or at least, the Board of Health behind this kind of effort. It would take time on our health department staff. I know the fire chief is on board. I've had conversations with the town administrator. If we have a good relationship to regionalize with this in our early discussions, we'll definitely look to that as an option, because that's a great way of saving resources. And, with smaller communities like ours, these individual steps, it's not going to be thousands of people. It may be 100 people, right? That's a lot of work to just vaccinate 100 in a week. And talking with our public health nurse, Ann Labonte, who's been running our flu clinics for years, I mean, she could comfortably vaccinate with 3+ nurses, 400 people a day. So the issue isn't the ability and the number, it's access to the vaccine, it's getting notifications, it's the signups, it's more of the logistics than the ability to just put shots in arms.
What do the doctors on the board think?
Well, it's going to be a question of when the availability of the vaccines and then the storage, right? Because they have to be stored at a certain temperature and then reconstituted when the patients come in for the vaccinations. And then making sure they follow through with the second dose. I mean, that's going to be the bigger issue, right? The first dose, people may want to come in, but then, you schedule them for a second dose 4 weeks later, 5 weeks later. Now they're not coming in at that time. Is tracking them down, making sure, because one dose will give you partial protection, but doesn't give you complete protection. And that's
Right.
what people, I mean, that's where the education is going to have to come in when they come in for their first dose. You can't send the police after them to come and get their second dose. It's just not going to happen. So I think that's going to probably be the bigger issue than the first dose. I'm not sure. Is there going to be a consent form, Kristen, for this shot?
So most local boards of health are using a new system called PrepMod. I'm not sure if you're familiar. So the state contracted with PrepMod. So it's a sort of registration software that's integrated with both insurance billing and also with MIIS, which is the states, where we're tracking.
Yep.
And so that's the other thing, given it's an emergency authorization, it's not just an FDA approved vaccine, there's more paperwork, and the state's requiring that anybody who administers the vaccine must enter all the data, right? The lot number, the name, and that information within 24 hours of it being administered. So long gone are the days of, we did our flu clinic and I've got 50 forms,
Right.
I'll get to them next week. You have to get to them that day. And for that reason, the state wants local boards of health to either be using PrepMod or show that they're using another type of sort of registration software. So Harrington Hospital is using, I think is it Meditech, or, there's different software. So you need something in place to track that. And, the PrepMod will automatically, while you're there, you schedule that second appointment. So you're leaving with your reminder card, right? It's all done. But if you stand up a clinic and you don't regionalize, we would be running it maybe every other week, right? And so if someone's traveling and it's not convenient, or, or I missed my appointment, or I didn't feel good that day, if we're all alone, it's a lot harder to be convenient for the second dose.
Right. So because most of the doses that we're going to get are probably going to be the same lot number, or, so is there some prep work that can be done ahead of time to fill out that stuff on this website or this software program, that you can document the expiration date, the dose, because the dose is going to be the same, the lot number, the name of the vaccine, whatever. I mean, I'm sure there's certain standardization that can go in there pre-populated.
Right.
The only thing you may need to change is, which arm you gave it in, left arm, right arm, based upon the preference of the patient. But everything else predominantly is going to be the same stuff. So some of that stuff could be pre-filled, so to speak, on the website. Because I know, I'm sure Swati does that same thing for flu vaccines. We used to get one lot of flu vaccines of 300 doses. Well, that makes it very easy. Just put it in the system and it's done, right? You don't have to keep doing it over and over again. So that might make it a little easier. And there's enough staff, I suspect, to do the phase 3 vaccinations in Northborough.
Well, by the time we get to phase 3, right, we open to the general public, like that's where we're going to want to see a drive-through, right? Like we just want to, pre-sign up, come with your forms, drive through. We've had some great models in other communities, our emergency dispensing site plans that we've been running. Teresa had attended ours a couple months back. It's all about lanes of traffic outside, just keep it moving, have people with scheduled appointments. So by the time we're at that phase 3, be looking for that mass drive-through weekend sort of clinic is our guess. It's getting to the teachers and the grocery store workers and all the, it's the phasing of this that makes it complicated. I think back, if we just need to vaccinate everyone, we'd follow our EDS plan and we'd be done in 2 weeks, right? Like that would be easy. It's the phasing.
Is there a plan in place to go to the sites, like for the schools, to immunize the teachers, as opposed to them coming in for the vaccination?
Yeah, we haven't gone all too far with that. I mean, the advantage if we do it in town, we'd have that control and we'd be able to, make it to the teachers, right? Could we hold it at the school that day? So the advantage is if we sign up as the provider, as the town applying, we can sort of bring it to them a little easier than if it's regional and we have 3-4 towns in our area together. It's more likely that, there's going to be set days, pick one, this is when you can go kind of thing. And with the teachers, I mean, the good news is you can schedule it after 3 o'clock and most of them can work it into their schedules. So,
I imagine they would. So the positives are really that we would be able to get more vaccine doses into the town, as opposed to just waiting for the state to distribute them, not
Yeah.
willy-nilly, but with their whim and not ours. So let's say we decide to go forward with the stand-up. What do you put in? We've got a stand-up, program going. Send us 16,000 doses.
yeah, so the way the state, you can only order whatever phase we're in. So we'd have to
Yeah.
estimate using sign up forms, et cetera, and really, follow along with the phasing. I mean, if we lived right next to Gillette Stadium and that was in our backyard, would we be having a different conversation, right?
Right.
We've all seen the horror stories on the COVID-19 testing and people waiting for hours in the parking
Right.
lot. And, so I think there's some balance of if we make it easy, are more of our residents going to get vaccinated, and if we can get it sooner to them, we could save lives, it's,
Right. I think we almost have to go forward with this.
Have any other towns already implemented it, or, are in the phase of implementing it?
So about 85, again, there were 85 first responder clinics statewide. And the closest that we worked with was Westboro. And so just now the state is saying, all right, we got through first responder. Now is the time if you want to sign up. So according to Jana Ferguson, our assistant commissioner at DPH today, she said she's received about 45 inquiries. Mine was one of them. So I had preliminary conversations to say, we have an interest. What are the steps? So I think, they're just communities are starting to do that. So, it's hard how the information's coming out. I mean, will every dentist be receiving this in 3 weeks and doing clinics for the public just out of goodwill? In another month, I don't really know, but our thought is, if we want to guarantee, they are asking local health departments if they have the capacity to do this, to take this task on. But it's not mandated.
And do we?
I think you find a way. I think we having a good partnership with our police department, our fire department, and the town managers behind it. I think we have the support and it can be done. But you guys are an integral part of the local public health department. So,
Right.
I want to hear where you feel on it as well. So with nursing, for example, the fire department has volunteered their EMTs to help with, obviously there's a 15-minute observation, which is, not what we normally deal with. And so there's that window. And talking to Sam and VNA, they're willing to contract with us and give us nurses who, we would pay through a contract. But again, this is all CARES Act reimbursable. And so we were thinking more that we would stand up a clinic and do 1 to 2 days a week, every other week maybe to start, and then we'd bring those nurses in. So we're not saying I'm running a clinic all day, come anytime. We're going to book those windows to fill those, 50 doses or 100 doses, during a 4-hour window or something like that. So it would be very scheduled for sure. So it wouldn't take my whole week, but the problem, it's the setup, it's the record keeping, it's the data logger on the, freezer to show that the vaccine's at temperature. It's an investment of time.
And there cannot be any no-shows because I believe like 10 folks receive through one vial. So if there are no-shows, that would be a waste of
right. So yeah, we really want to make sure people come, and then that's why we need the backup call list. So the state has been generous in saying if you have a no-show, we don't want you throwing out vaccine. Find an arm, right? So towns I've heard of with the first responder clinic, they sort of worked through their lists. They had a few left. They found an arm of someone who was in the maybe town hall building or called somebody they knew. So, I mean, you're not supposed to plan for that. It shouldn't be call all your friends and family to fill a 2-hour slot. But the state is generous. The whole idea is, get the vaccines in your arms, try to follow the schedule as best you can. And then once you get that first vaccine, you're guaranteed the second. So if you lucked out and you were the security guard working on, Tuesday night and you got the, 100th dose, you're guaranteed to get it 2 weeks away. So that's sort of how it works.
Can I ask, do you have any sense of how many clinics you'd have to run based on the population of the town to get through the second set of vaccinations of phase 3? Just trying to think of what the toll on our human resources is really going to be over the long term.
No, that's a great question. I mean, it really comes down to the other question is, are we including Northborough employees, right? The health of our community is it's our stores as well, right? It's the Wegmans grocery store workers. So it's that could totally change your numbers, right? Is Wegmans going to be ready to stand up a campaign, like a vaccine clinic, or would they be looking for us to do it if we can get it sooner? And on the financial end, there is the ability to bill. So it's not really about the finances. I'm just pulling out my computer. My calculator here. So we have a population of 15,000 approximately in town. It would be reasonable to be able to do, let's say if we really ramped up and had nurses there and EMTs working, we could do 400 doses in a day. Okay. And so that's only 37 clinic days total, assuming, but again, we didn't take the kids out of it. And then you need the second dose. So that's just total, days. So it would take 37 days at 400 doses a day to get through our 15,000.
That's for one dose.
Right.
One dose.
Do it all over again.
Right.
So
So we're going to pull out everybody that doesn't want it, all the kids out of that population, people that are going to receive it at their workplace. So, I don't know what that real number would be closer to. Would be looking at, 10,000 realistically in our community. I could talk to the town clerk who has the census data to get a better feel on that. And again, I think once this opens, people will also be getting it at their provider. I'm going to my doctor anyway, and they had it available, or my dentist office has called me and they're doing so I don't know if in the end we're going to be the primary vaccinator for our residents in town. If you think to the flu vaccine, it seems like we're not the number one place where people go. But if we're there first and standing it up, we could be. And if businesses are really not having access, so our employees in town come from all over. So if we're more organized and it's available, they're going to want to get vaccinated here. And is that something that we'd be open to?
Makes sense to give whatever we are getting from the state to the UMass clinic that runs in Northborough across Wegmans, so that they have the personnel. There are the trained nurses there, so
yep.
Possibly they have even the patients their primary doctors are at the clinic. I think it was important to know also, was the patient tested for COVID recently? Did it have COVID within, the last couple of weeks? Because chances of having a reaction are much higher if someone had an infection recently. So would it make sense to then give our doses to the clinics?
So I think the way it works with the state, the clinics will be able to request it as well. So they won't probably need our doses, and the state doesn't want you to move them around without a special agreement, right? So if you receive it and you filled out the user agreement, they want you to administer. Otherwise, you would just ask for the clinic to request more. So that's where we could form relationships. And I'm new to town, so I don't know how many doctors' offices would really be able to offer this. I mean, a great way to get through this is to partner with the Marlborough hospitals or the UMass clinics and say, I know you're going to help your patients, but can you vaccinate more than that? Can you help our employees in town? Because not everybody has a PCP, right, or their doctor's not running a clinic, so then they don't get it and they aren't given that opportunity. So how do we make it equitable and make sure we can ensure we're working through these phases? So I don't know if you have relationships with the UMass clinic over by Wegmans. But I think this would be a good time to sort of forge those connections and begin those communications if you have any good points of contact with local providers as well.
So really, it's a lot of paperwork. That's sort of the hesitancy.
Yeah, it's, yeah, paperwork and time.
Time.
Yeah, I mean, I talked to Jamie Terry, your prior agent. She said through H1N1, you held 22 clinics through H1N1. You know, so,
Well-
you know, it has been done at the local level. That was a little,
Right.
maybe a little easier, less forms, but you know, it can be done locally and we're being asked to. So I think, again, you were not gonna say to the state, give us 10,000, it's gonna sit on
Right.
a shelf. The state's gonna give us, you know, 400 that week, and then they're not gonna let you reorder till you showed that you've actually entered them in MIIS. And that's the reason why they're requiring you to enter. They don't want anybody stockpiling it, you know, use it or lose it, sort of situation. So, it's gonna be a slow demand. So you vaccinate that week. I think on Monday, the forms are sent out. You place the orders by Wednesday afternoon if you need additional vaccine.
Sounds like something, again, that we're gonna have to embark on.
Yep.
For the sake of the town. This is finally a health situation the Board of Health has got their grasp on. I think, in my opinion, it sounds, unless I'm missing something, sounds like we really don't have a choice.
Okay.
Can we hire somebody else to help do something in the office type thing?
Yeah, there's definitely
Let's
an
get some
ability.
interns.
Yeah, I know. There's definitely an ability with CARES Act. And we've had lovely residents reaching out, retired nurses, et cetera, that want to help, you know, with even, you know, administering the vaccine. So I think once it's just getting this set up. I think we're gonna
Yeah.
have the volunteers, the EMTs behind it. It's just good to hear, you know, you guys are behind it as well. So I think it's something that could be done. I think if we can regionalize and it makes sense that it's a good regional partner and we feel that it's a good plan and our residents would get, you know, preference or, you know, would be treated well and it would be convenient. If these regional talks go anywhere, just like this Westboro First Responder Clinic, we may consider that as well, because that may even be more convenient if we can have the clinic open more. I'd rather drive one town than just saying, sorry, we don't have it this week. We're not running our clinic for another 3 weeks. So I think, you know, but it's all about, you know, either a regional local health clinic or just town of Northborough. I think those are our two options moving forward. And I want to explore both of them because, you know, sharing staff just makes sense, right? Sharing, you know, locations, the burden, administration. I think it makes sense, but we don't want to be part of a 20-team region that, you know, we're going to be so low on the list.
I think
agree.
regionalization would make so much sense because, you know, if a town resident's not available for the Northborough site today, but they can make it to the Westboro site tomorrow, then that makes it easier, or Shrewsbury site, depending upon which towns we regionalize with. And then same thing for those residents. If the Shrewsbury residents going to be available for Northborough, then that's fine. They just have to make sure the paperwork is all filled out ahead of schedule. That's all.
Right.
So I think the regionalization makes, yeah, but you don't want to have 35 sites, 35, you know, communities. That would make it very tough.
Yeah, no. What about like Southborough? We got Northborough, Southborough, keep it.
Northborough, Southborough, Shrewsbury, Westboro, you know, like 4 or 5 communities, and, you know, and maybe each town runs the clinic one day of the week, you know, Monday, Tuesday, Wednesday, Thursday, Friday. So if you happen to be a Northborough resident, but, you know, Shrewsbury is on the day that you can make it, well, you go to Shrewsbury or go to Westboro or
Right.
Southborough, wherever it happens to
Right.
be. I mean, that
Yeah.
makes it so much more this thing. And then you could have one central storage place for the vaccinations, right? That would also make it easier. Then each town doesn't have to have that fancy refrigerator, which can store it at that -70. You can have one central storage site, which would make it easier.
Mm-hmm. No, I think it's great. So I think where I'd like to go from here and you know, and hearing your support, I think we'll definitely, I should know more and have some of those discussions about standing up a regional clinic. And if we don't really get much traction there, we can pull it off locally. Just within the town of Northborough, I feel confident, you know, the fact that we can contract our nursing services and Sam and VNA feels they can commit the nurses. We could do it that way as well. So,
I mean, I can throw my hat in there to come and help out for the 8 hours or whatever it is too. I did it for the flu vaccine one year. So
that would
I
be great.
Actually, my company actually gives us 8-hour volunteer time, so I can even use that
Sure.
if I have to.
Oh, that's great. I did hear from Westboro when they ran the first responder clinic yesterday and today. One of their board members attended and was just there to answer questions. They found it really helpful to have a medical doctor. You know, someone had, you know, a condition or a question as to whether or not it was appropriate for them. And, you know, everyone loves to, you know, have someone to ask those questions. So that would any volunteer effort from any board members. I mean, in these clinics, I saw the Harrington Hospital clinics, you know, there's a check-in process, and then there's registration, and then there's the
Mhm.
observation. So there really is going to be those opportunities to volunteer, you know, for those that are interested, and we'd call upon our medical reserve corps
Yeah.
as well to be part of that.
We have the Medical Reserve Corps.
Yeah.
This is their thing.
Right.
All right. Well, that's good. How do we go from here? Like time-wise, what do we have to do? Anything?
No, I don't think we need to do anything formal or a vote. I just, you know, this is an important topic. I wanted to keep you up to date.
Yeah.
And I think I'm hoping we're going to have meetings about the regional options in the next week or so. And I'm looking to make a decision and move quickly, because I think the way it's
Yeah.
going to go, if we, you know, the state vaccination team in Boston, they're already overwhelmed. And before you know it, they're going to be dealing with every local little provider and medical office
Yeah.
asking for it. So we want to get ahead of the line here and make sure we're on the list and get these relationships agreements and all the paperwork in place. So I would think, again, we'd be aiming for the phase 2 clinic. So I would be thinking the earliest, you know, first week in February kind of thing.
All right. Excellent. Excellent. Good.
And so I can try to share that screen again and pull up the agenda.
Agenda.
Let's see what we have. And okay. And my screen's not showing very well tonight. I don't know why my computer is acting up, but I'll just look back to that
Yeah,
screen.
what's
So
on there?
Oh, it was? I couldn't see it, but here.
No,
Okay.
Kristen, take it away. What else we have?
Okay. Yeah, so I just have number 4 is an update on the previous discussions on reflexology. So we had talked a little bit about the reflexology establishments in town, and that, you know, Bodyworks or reflexology is not licensed, or it doesn't fall under a regulatory board. I did reach out since our last meeting. I think Teresa sent a sign to me that was showing like a massage advertisement. So we talked before about if these establishments advertise as massage, they have to be licensed as massage parlors or massage establishments. And so the state inspectors are coming out. So I didn't want to jump ahead with going through regulations until we have those inspections completed by the state inspectors. They're in conversations with our police detective in town, and they're anticipating doing those inspections sometime this month. So I just wanted to let you know we're slowly getting there, and we'll wait to see what comes out of those inspections and the recommendations from the state inspector, who's under the professional licensing board. What they find and what they would recommend we do is to taking local action.
Good.
Great, thank you.
You're welcome. And then I think next on the agenda, Kate, we just said establish a tentative future meeting date, and that's for February 9th. So.
Sounds good.
Okay.
All right. Does anyone have a problem with February 9th?
Nope.
Nope.
Nope. Wonderful.
Teresa, Kristen, I'm going to send you a thing that I received from the Board of Health as part of the thing, because from what they said, that they're going to have regional storage facilities at hospitals, and then providers are going to be able to go and get the vaccinations from there.
Yeah.
So they don't have to keep it stored, but you know they're going to get small batches at a time, and may have to go back frequently to do that. I'm sure you probably got that from the DPH.
I heard about it today on our call that providers were getting that information, but it would be great to actually see it firsthand. So if you can forward that, Dr.
I will forward that to you then.
That'd be great. Thank you.
Okay. Yeah, because I mean that came from the DPH, and I'm wondering if that came to me not because I was in practice or that thing, because I'm on the regional emergency thing that Jamie still reaches out to me on a yearly basis to make sure my numbers are still valid, et cetera.
Yeah.
Yeah.
So I don't know if it's from that or from being in practice. I'm not sure what, but
Okay,
but I will forward that to you after the meeting's over.
great. Thank you.
All right, have we taken care of all business?
Yes.
Kristen?
We are
Did
all
we vote?
set.
Did we vote on the meeting, the minutes from the 8th? I think we did.
Yep,
Yes, we
there's
did.
So yeah, we just need a
Uh,
motion to adjourn if there's nothing else. And again, feel free to reach out. I'm sure you may have questions, or if you're, recommend the public calls the health office. So we're here to support everybody, and we're fielding a lot of questions about isolation and quarantine, and my cousin, and I was with him on Saturday, and contact tracing and all that. So again, we're happy to field those questions. A big thanks to Katie and Angie in the office, who have been very kind and accommodating with as frantic things have been. And so a big thanks to them for keeping everything moving. And, and then all those
Good.
daytime things we do, like septic and wells, and those are still progressing. So
We're
thank
still moving along.
you. Yeah, we have to.
Life goes on.
Yeah.
All right, somebody take us away. Take a motion to adjourn the meeting, please.
I motion to adjourn our meeting on January 12th.
I
Second.
second that motion. All those in favor?
Aye. See you,
Excellent. Good
see you
meeting.
in February.
Yes.